So the way this will work is that we will first hear from me. I will kind of do a short introduction. Then we'll have three panelists who will speak to the topic of what the impact of this virus actually is on the political landscape in China specifically, but also in the world. What does it mean actually to have an outbreak of that proportion? Then we'll talk about the economic impact it potentially could have. And then finally we'll also talk about the public health impact of an outbreak like this. Let's start with the basics, so that we all in some ways know what this is actually all about. So what is the coronavirus? Anyone knows?
It's a virus.
It's a virus, very good. Virus means it's not bacteria, and if it's not bacteria, what medicine does not work on it? Antibiotics, very good. So no matter how many antibiotics you throw on it, it will not actually influence the virus, and that is crucial because it means that there's currently at least no official cure yet. There are antiviral medicines that might make it better, but there's no official cure. Now, why is it called the coronavirus? Because it looks supposedly like a crown. You see this here a little bit. It has these spikes coming out all around it. These are the kind of the docking stations in which the virus can kind of dock onto a cell, and then gets kind of almost like a lock and a key. These spikes are the key. They're locked with the cell, and then it goes actually into the cell. And I know that if anything I say wrong, please do correct me.
You're doing great.
The expert right here. So the idea is that the coronavirus looks like a crown, and this is why it's called that way. There are more than this one coronavirus. In fact, we have four very typical coronaviruses that go around the world all the time as common cold. And so you probably had multiple coronaviruses already in your body, and normally that's not a problem. You kind of just deal with it. You get a sore throat, you get a cough, but ultimately you will just recover, no problem. There are some, however, that have more serious impact, and there are three of them that we know have jumped from animals to humans, and those are the SARS, the severe acute respiratory syndrome, that I think showed up first in 2003, was mostly confined, I think, to China, Hong Kong, but it didn't see that many cases outside. And the advantage, in some ways, or disadvantage, perhaps, the virus was comparably easily recognizable because you had extremely serious impact on your health. And normally when you showed symptoms, you also were infectious, and so ultimately you could catch people who actually were infected with this right when they showed the symptoms. You could treat really only the symptoms and hope for the best. They eventually developed a cure, but the cure had a lot of side effects, and so ultimately it was never actually given to people because the illness simply went away after all the cases had been isolated. MERS, or MERS, M-E-R-S, is the Middle East respiratory syndrome that's specifically actually or often seen in the Middle East, as the name suggests. The reason is that it's kind of from camel milk, camels in general, that actually kind of pass this on. So anywhere where it's close to camels, you might actually catch this virus. It's very dangerous. When you get it, the likelihood of you dying is very high, but it's almost impossible to get it unless you are, in fact, interacting with camels every day. So most of us, if you're not a camel breeder, you probably don't have to worry about MERS or MERS in a way. But it's still around. You actually can still see cases from time to time. They simply come up. The last one, the COVID-19, this is the novel coronavirus that just kind of broke out right now in China. This is a new virus that we don't have any herd immunity against. We don't really know yet how to treat it. So where does it come from? I already suggested that MERS comes from camels. In this case, we suspect, we don't know, but we suspect that this is actually a bat virus that didn't jump, however, directly from bats to us, but actually went over another animal. There are some who assume that it might have been a pangolin. This is this animal here in the middle, the scaly animal. Very cute to look at, but potentially if it actually has the virus and you come in contact with the feces, or you eat the meat and it's not rightly cooked, or it scratches you, or there are ways of how this virus might have jumped from a bat to this pangolin or some other wild animal, and how they might have ended up in a wet market where they are actually sold for food. And so if you cook a wild animal, or you are in contact with a wild animal, the virus might have made a jump from, through a mutation to a human being. And scientists assume, and again, it's not clear which animals are actually all involved. Bats are likely, but not the only possible explanation. You also see here bat soup, but it didn't come actually from bats in this case, at least not directly. The one thing, however, we also know is that it might have just happened one time. It might have been just one single case of a single person potentially being infected. But the market since has been closed down. The Wuhan market is closed down. They totally disinfected everything. So currently, at least, it wouldn't anymore come from animals. Now it's human-to-human infection. How is it transmitted? So for the most part, the virus is transmitted if you have symptoms. You show normally symptoms, which would mean if you sneeze, then particles that you cough up from your lung would be distributed through the area, and this can be up to 3 to 6 feet that you actually kind of spray this out. And so people who stand in your close proximity might actually breathe this in, and then you could also catch that virus. Even if the person does not sneeze directly on you, they might sneeze on a surface, and then you touch the surface, and then you touch your eyes, or you touch your mouth or your nose, and that way you catch it. So it could be droplets that either directly go to you or go on the surface and you touch the surface. So this is why they always advise you that wash your hands and stuff like that. The problem with this virus is it seems to potentially be able to spread before symptoms arise, which means that even if a person is not showing any symptoms yet, they might already be contagious. And there are some indications that it's even possible that after they are actually better and have recovered, they might still have some of the virus in them. We just don't know if it's still active and so can infect you, or it's actually deactivated in some sort. But yeah, mucous membranes are the prime point where they would enter your body. So anything with your eyes or your mouth would be potentially open. The one thing that we still have to ascertain too, there were several reports, and then they were denied again, that suggested that the virus might be transferable through air. And that would be very bad, because that would mean that the reach of the virus is much more than 6 feet. It could actually be easily, as you see this here in this picture a little bit, could easily be 12 feet or more, which means that if you're on a train, you stand on one side, and a guy coughs on the very end of the train, and you stand all the way down on the other. You could still potentially catch it if it actually is an airborne virus. Hopefully it's not. We don't know for sure, but if it is, that would be certainly making this whole thing much, much worse. You might not have heard about this. I didn't hear about this until very recently, that there is this idea of how many people can be infected by one sick person. And the current number of how many people might be infected by one single person is between 1.5 and 3.5. And even though this sounds like a small number, the difference is enormous. If it's more than one, which means then it just goes by, not just from one person to one person, it doubles each time, you have another kind of installment of this virus. If you actually triple it each time, the numbers get enormously big. So let's hope that it's really around, more like 2 rather than 3.5 or 4, because that would be very, very quickly kind of spiraling further and kind of multiplying. You can see this a little bit here, how one person gives it to 2 people, who then gives it to 2 people, and further and further. So it's kind of this pyramid of how this develops. What are the symptoms? For the most part, it's pretty obvious, like what you expect from a cold. People show up who have fever, people show up who have a cough. That's the typical thing that almost everyone shows. But it develops over time. You can see this here a little bit, that if you have a fever, you might have actually started with a cough. Eventually you develop higher and higher fever. At some point you might actually get a stuffed nose, you might have nausea, you're fatigued, you might throw up. All these things that are involving also your stomach could be involved. But normally these symptoms show up later. There's only one problem. The problem is that 10% of patients seem to show atypical symptoms. So they might come to the hospital and say, hey, I have a stomach ache. You think they don't have the virus, they might have something wrong with their stomach. You put them on the regular ward where you either operate on them or have them in contact with patients who are not actually sick with the coronavirus. And then you figure out, oh my gosh, not only did we not put any, extra caution in our own protection, we might have infected other patients as well, because there are some cases that are atypical and don't show the sneezing or the coughing or any of this, at least not right away. So this is a little bit tricky here, so you have to be cautious in some ways how you treat people who come in with things that are not typical for the actual illness. How dangerous is it? In general, we don't know, because we haven't seen the full illness yet. So you normally need to have the numbers that of how many people are infected and how many people have actually recovered, how many people have died. If you don't have the full number, you're always about, about 30 days behind. We really don't know how many people will die in 30 days and how many more people will then be infected by then. So it's difficult to make an assessment here. What we do know is that the fatality rate of COVID-19 is about 2%. 2% is very low in comparison to SARS. SARS is much higher. I think SARS is about 10%. And it's much, much lower also than some horrifying diseases, I'm not sure, Ebola, or that are much higher. If you catch it, you might have a 2/3 chance to die. This is not the case here. So it's comparably a small number of fatalities, but if you compare it to the normal flu is about 0.1 fatality rate, which means the COVID virus is still 20 times more dangerous than the flu. So it's not like the flu, it is more dangerous, but it's still, in comparison to some of the other diseases, much less fatal. But it might be more infectious, it might spread more easily. When we actually see these cases, 81% have a very mild case. Most people go through this, don't seem to be impacted by this much. So they might have some cough, and then they feel better, and their life goes on. The problem is the rest, the 90% that are catching it and have a severe case. So a severe case might be pneumonia, if your lungs filled up with fluid, that's really bad because it means that you might need a respirator or oxygen or a hospital bed, and the resources for how many people can actually access these resources are limited. So as soon as you run out of hospital beds, then you face a real crisis because you are trying to treat people who need hospitals, but they simply can't go to one. What do you do with those cases? 5% are critical. They normally show an actual failure of the respiratory system. They might have organ failure. These are obviously very serious impact. Many of those patients, if they don't get the right care, might die. So you need to be prepared for, potentially a lot of cases that need urgent care, specifically for this virus, especially if the numbers should be high. Hopefully they are not. But important is here, 19% of cases might require hospital, 5% required for sure. How do you stop it? The best way to stop it is to not catch it in the first place. Or if you have it, don't give it to anyone else. So first rule would be washing your hands all the time. If you have touched something, a surface, if you touch someone else, all of this would require hand washing. And normally hot water and soap does the job. Just wash it long enough. In some ways, you have to actually have 20 seconds, I think, is the rule. So what they don't seem to recommend is actually these alcohol, because alcohol, you need 30 seconds or like really long time before it actually starts killing the virus. It's much easier to just wash it off and be done with that. Close contact, avoid close contact if possible. Don't touch your eyes, don't touch your nose or mouth, especially if you have touched before something else. The mask and the eye protection, this is obviously something that's up to you, and it might not be culturally acceptable everywhere. So if you run around in a mask, people might be like, oh my gosh, what's happening? So that might sound extreme to some people. The reason the masks are used is not so much, by the way, to protect yourself immediately from your surroundings. It's actually to remind you to not touch yourself in the mouth or in the nose. If you have a mask, you simply can't do it. And so that might actually limit how much you can actually catch, just because it limits your ability to kind of interact with your face. Quarantine would obviously be if you catch it and you kind of self-isolate, or you go to a hospital where you would be isolated. That would be a way to deal with it, as long as we don't have a cure yet. What's the impact? The impact currently is pretty severe. We have probably around 150 million Chinese people under quarantine or some form of travel restriction. And Dave, correct me if I'm wrong there. It's a large amount of people. Basically, what, half the population of America basically is currently under some form of travel restriction and quarantine, just because they want to make sure that people are not cross-infecting each other or travel to regions where they could spread the disease further. The question is, what happens now with Chinese leadership? Two officials were actually removed in Wuhan that were in leadership positions and replaced. The question is, what is the political impact here? What will actually happen in China itself, but also in other countries that might be impacted by this disease in terms of politics? Number two, we also know that China is the workshop of the world. A lot of stuff is being produced there. Almost all the parts for computers, for your cell phone, for your car, for even medication. We might not be knowing this, but a lot of the medication that we use, antibiotics for example, are produced in China. So if China shouldn't produce these things anymore, there might be shortages of all kinds that impact things far and wide, much further than just impact on China itself. So we'll talk about what the impact, hopefully, is not on the world. Finally, scientists are currently working on a cure. The question is, how much time will this take? A lot of people are warning us that even if they found a cure tomorrow, the fact that you have to run it through a series of tests and you have to make sure, is it safe? It might take up to a year before this cure actually goes into production and then can be widely distributed, which means for a whole year, you might actually be looking at containment rather than curing any disease. So we'll talk about the public health impact as well. I would like to invite our three panelists forward to sit here with me. Dr. David Liu will actually talk about the political impact. He is a professor in political science. We have Dr. Jody Lipford, who will talk about the economic impact. And finally, we'll have Dr. Shull from the biology department, who will talk about the health impact on the world, as well potentially specifically on China. So I would like to first of all welcome our panelists. I'd like to turn the floor over to actually David to actually make his remarks, and then after we have gone through all our panelists, we will actually be able to ask questions.
Okay, first of all, I would like to thank Dr. Wiecki for inviting me and to host this event. And I also found something new today that I didn't know Dr. Wiecki had a medical degree.
Yes, no.
You got it. Okay, as we have seen, that the impact today has been rather severe, and I have been invited to talk about the political aspect of this crisis. And before I do that, I think that culturally, this should lead to significant changes in China, as nobody would be eating bad things. And one thing that is rather curious about the case is, as you might know, that China is a rather huge country. And within China, there is a long river that divides the China roughly into two halves. And the people to the north of Long River are called northerners. And Wuhan, they are considered the northerners. In China, the northerners, we are typically not that adventurous in terms of food taste. So for the fact that this actually happened in the city of Wuhan is a rather strange case, because people there do not usually eat wild animals. As you further head on to south, particularly in Guangdong province, or even in southeastern Asia, they actually treat bats as a delicacy. And people eat a lot of them. And so there were questions asking why this happened to Wuhan, and maybe by chance our biologists can help us understand. In regard to the political aspect, I'm going to talk about in three dimensions: the local, national, and international. At the local level, some of you guys might know that when this virus emerged, there was actually a doctor in Wuhan named Li Wenliang who actually discovered that. That was much earlier than the official report of the existence of the what he did, he's actually an eye doctor. Okay? What he did was that he found a particular strand of virus that is very similar to the SARS virus that China experienced between 2002 and 2004. So what he did was that he actually spread the message through WeChat, which is a very popular Chinese social media. And he didn't actually disseminate that with the wider public. He shared that information with his classmates, the group chat. And people caught on to that. Because he actually shared some of the CTs that were taken in his hospital to show him, okay, there is a pattern of viruses, and the people who were infected were actually linked to a seafood market, which is a front for selling wild animals for people to consume. So he spread that, and his friends further passed on that message. What happened to him? Because he reported this, he spread the message on December 30th. The official report didn't actually take place until January 12th. So there's a 2-week critical period. He was actually brought in by the police. He was actually brought in, questioned, interrogated, and people were accusing him of actually spreading false message, rumors, because that's all over the internet. People were panicking. And what the police was doing was that they actually asked him to write a confession before he could go home. He had to sign the confession, and then, which later on he posted online, on the social media to show, okay, so before the whole nation knew that I spread that message, and I have been asked to self-criticize and never to do that again. And that eye doctor, later on, actually contracted the virus himself when he was seeing a patient in his hospital. He died on February 7th, and at the age of 33. A very young and courageous doctor, a whistleblower, and he died. And people knew about it. Around the world, there's a piece on New York Times that you guys might want to refer to that. So this shows that one thing at a very local level. This exposed the deficiency in the Chinese political system. That is a top-down system where it is very hard to manage the local accountabilities. Because the local officials, they are beholden not to the people they are supposed to take care of, but to the officials, their superiors, and the officials in Beijing. And today I'm speaking in front of the camera, I know. And I still want to say this. This is something that the country needs to actually pay attention to. This is the kind of political system that the nation, that China has taunted about how efficient it is. But at the very local level, there is a deficiency, there is a problem that cannot be resolved, like Dr. Wiecki mentioned, by simply removing the party chiefs of Wuhan and the Hubei province, which is kind of like the state government. They were removed. It's not about the people, it's about a system, it's about time to increase accountability at the local level. So I think that's the first thing that I want to touch upon in regard to the virus. And secondly, at the national level, Dr. Wiecki mentioned that right now there is kind of a lockdown in China. There's a quarantine, and given the severity of the disease, okay, it seems warranted. As of now, the current status, the city of Wuhan was actually quarantined on January 23rd. the whole city. It's a city of 11 million people. The lockdown took place 2 days prior to the Chinese New Year. And for those of you who know about the Chinese culture, it's a time for people to go home, to visit families, and estimated this year, there were 3 billion people supposed to be on the move. The lockdown, the quarantine came one step too late because there were estimated about 4 to 5 million people they actually left Wuhan before the lockdown. So what evolved was that this became a national issue rather than a local issue, and after that point, the whole province of Hubei, which is a province hosting 60 million people, quarantined. And there's a national lockdown as we speak right now. And like I said, given the severity of the situation, it's understandable. But still, that when you have the kind of political system, you have the overzealous local politicians who are taking the matters into their own hands, who impose unnecessary restrictions. As of now, that there are approximately 760 million people, okay, not quarantine, but there is a lockdown. And I'm gonna talk about my hometown, which is a kind of just a little bit affected. Because given how well connected China is today, you can take the high-speed train everywhere. That's what the country has been touting for years. Actually, that all over the nation, people go all over the nation. In my hometown is a province in northeastern part of China, which is over 1,000 miles from the city of Wuhan. There are currently around 30 cases, okay, which is not all that much. But that province currently is under a lockdown, and my parents, they still live there. So I communicate with them. It's kind of now the panic. They have become even more dangerous than the virus themselves. And with regard to the lockdown right now, that people everywhere in China, as during the Chinese communist era, I would say that so when they were true communists at the time, they actually went down to the residential neighborhood to actually enforce the quarantine and to monitor everybody. That is everybody. And my parents, they live in a gated community, so for safety. So every morning, so when they go out, they check your temperature, okay? Every time they check your temperature, if you are having a fever or likely symptom, you are taking in for the mandatory quarantine. So they're telling me they're no longer doing the morning exercises. they're staying at home, okay? They're staying home. It's with around 30 cases in the province of Liang that has happened. And with that being said, the national response, in my opinion, has been swift once the government recognized the severity of the issue and very well coordinated. So over that time, that there have been numerous medical professionals from all over the country. They actually rushed to the city of Wuhan to help, and those were on volunteer basis. And do not just misunderstand China to see, okay, in China that people do whatever the government backs, okay? And like in the United States, and some people do give them the middle finger sometimes, and it's all on voluntary basis. They went into the city to help, and now the medical professionals, they are under the threat of the viruses themselves. Just yesterday, as I was reviewing the information, there is the director of one of the Wuhan hospital just died from the disease. Okay, and I think the national sentiment is kind of like when you are having a major crisis, that the nation is more concerned about the viruses than about the aftermath. Okay, so the people were united, and there's also the, some of you might know, there's a makeshift hospital that was built for Wuhan in just 10 days, 1,000 beds. The country is highly efficient still, but it is a difficult problem. And lastly, internationally, I'll be short on that. Just compared to SARS, as of now, that there are over 2,000 people who have died from the virus, around 75,000 people who are confirmed having the virus, and only 1,000 outside China. So compared to SARS, I think what China did was that it did the right thing. It actually was quite transparent from the beginning about the disease. It did result in some kind of a more xenophobic reactions from other countries, which is regrettable. But the country did the responsible thing of reporting the cases. Now the infections outside the country has been rather limited. Okay. So I'm going to stop here and yield the floor to my colleagues to talk about that rest.
Thank you.
Okay, well, thank you again for the invitation, and I'll talk briefly about the economic impact. First of all, let's just think a little bit about the sources, then we're going to think about estimates of the effects, and then we're going to try to make some sense of the numbers. The sources, people will probably immediately think, how much does it cost to treat these people? I don't know. And whatever that is, though, that's probably going to be very, very small relative to the avoidance behavior that we're going to observe and are observing. So if you start thinking about curtailed travel, curtailed shopping, suspended flights to China, that's, we're getting to a bigger deal now. If you start thinking about disruptions in supply chains, that's a big deal. Now, the big question that no one knows, and Stefan's already alluded to, is, how's this thing going to play out? How long is it going to last? And we don't have answers to that. Thinking in terms of the first quarter of this calendar year, and David's already mentioned the Chinese Lunar New Year, so production tends to slow down anyway during the Chinese Lunar New Year, and business knows this, and so they tend to stock up and make an allowance for this in advance. So businesses are not in a real dire situation right now with respect to the supply chains, but the longer this holds on, of course, the more critical that becomes. So that's what I think we really want to think about. Suspended retail, suspended travel, and supply chain disruptions. So I was thinking about, how much is this going to be? Can I find someone who's going to give me some good estimates? So the Wall Street Journal was very helpful. It said that estimating the economic impact of this is, quote, a potentially futile exercise. So y'all were supposed to laugh. All right, so anyway, no, we really don't know. JP Morgan Bank has come out and said that as far as US GDP is concerned, that's going to be, probably shave about 0.3 percentage points off of that. So let's talk about that a little bit. First of all, what in the world is GDP? Well, that's gross domestic product. So if you haven't taken an econ class, think about the value of everything that is produced in an economy in a year, or in this case, we'd be thinking about a quarter. So add up the value of all of the haircuts, all the CAT scans at the hospital, all the H&R Block tax returns filed, all the cars that come off the assembly line, all the kilowatts of electricity that the utilities produce. I mean, just everything in every sector. If you could add up the value of all of that, that's gross domestic product. And so 0.3%, well, what in the world is that? I mean, what does that mean? Well, for the United States, we're talking about gross domestic product, a above $20 trillion. So, well, so that means 1% is 100 billion. I'm sorry, 200 billion. And then 0.5% would be 100 billion. And we need to divide this by 4 because these are quarterly estimates. So, yeah, you know, a 0.5 percentage point would be $25 billion. And that's a lot of wealth. That's a lot of wealth. Okay? So in percentage terms, it may not seem that much, but in absolute dollar terms, it is quite a bit. Another estimate I looked at from Economic Outlook Group, they estimated about 0.4% reduction in U.S. GDP growth in the first quarter. So we're looking at, you know, something bumping up against 0.5 percentage point, or again about $25 billion for the first quarter itself. Is this something to be alarmed about? No, $25 billion is $25 billion. Is a lot of money. Okay, that's a lot of output. Again, it's a percent of the pie, pretty small piece. But let me see if I can give you something to think about, something to gauge it by, if you will. And that was what I kept thinking, because we confront this all the time in economics. You know, there are all these numbers and all these big numbers, and what do they really mean? And if you walk down the street and you ask the average person how many zeros are in a trillion, they're probably going to pause and have to think about that a little bit. And they may or may not figure out there's 12. But to try to put this in perspective here, the economy's facing some real headwinds in the first quarter. Hopefully, again, they're not long-term. This coronavirus is one of the headwinds. But another one, Boeing shut down on the 737 MAX. That's going to be roughly of the same magnitude, maybe a tad more, about 0.5 percentage point of GDP in the first quarter. So that's a big deal. What about the tariffs? That's one of the first things I thought about. Everybody's making a big deal out of this virus, and understandably so. But Trump's tariffs, the imposed tariffs and the threatened, which have not yet been imposed, but imposed, threatened, and then retaliatory. Let me explain that, because, well, what we observe in international trade is very little adherence to the Sermon on the Mount and Jesus' admonition to turn the other cheek. Usually, if one country puts tariffs on another country's goods, the country on which the tariffs have been placed turns right around and puts tariffs on the initial country's goods. So this would be retaliatory tariffs, is what we would call those. So, you know, it's kind of a tit-for-tat mentality that most countries have. So if we were to add up the value of all the imposed tariffs, the ones that Mr. Trump says are going to come through, and then the anticipated retaliatory tariffs, that too, according to the Tax Foundation, comes out at about 0.5 percentage point of gross domestic product. So there's your estimate right there about what this is going to be. If this thing really drags on, if China is not able to get its manufacturing sector up and running, or keep it running, then the effects are going to be far more widespread and severe. Once again, to put this thing in a little bit of perspective, there's been a lot of reference this afternoon to the SARS virus. So back in 2003, China accounted for 8% of global manufacturing, and that's now up to 19% of global manufacturing. So if China goes even a little bit offline, that has a big effect on the global economy. Thank you.
Thank you.
All right, so I will.
Correct everything I said.
No. So I will finish up the rear here, and again, to continue on with a lot of my colleagues, I'm going to thank Dr. Wiecki for being able to do this. And I want to thank Dr. Wiecki for saying a lot of things that I wanted to provide preface to, and so you did that good. So I appreciate that, because there's a lot of information about the spread of this virus that is absolutely true. And what I've been having a hard time with this virus is something that is very, very serious. There's no question that this virus is very serious as far as what it causes, what it can do, and the unknown about the virus. So you have that on one hand. And the overreaction to it as well. And that sounds weird to say that for something that should be taken very seriously, this particular virus. Because I want to provide perspective, because you see a lot of the numbers that we've we've heard, you saw the R naught value that Dr. Wiecki referred to, which is this idea of this reproductive number of how many people can another individual infect when they're infected with the virus. So, you may have heard this before, there are 3 types of lies, damn lies, and statistics. So, let's talk about the R naught value for a second. So the R naught value is its ability to spread. Ebola, a very, very, very serious virus that Dr. Wiecki referred to, it's about 2. One that is around 23, measles. And I'm not trying to downplay measles by any stretch of the imagination. Measles is a very serious disease. But one thing that we do not worry about in this particular culture, in particular society, is measles anymore because of the introduction of vaccines. Now, obviously there's not a vaccine yet for the coronavirus. But you have to take into account what is the respective understanding of the R naught value and what is it trying to tell us. Because that's another aspect. The R naught value is trying to tell you, on average, how much does this spread from one person to another. That becomes a relative term. And the reason I'm kind of talking about this now is to talk about this from a maybe domestic understanding in the U.S. compared to how that affects in Wuhan. So right now, we kind of understand there's about, I think, was it 7,000 deaths and about 72,000 cases that have come to the Wuhan province. Now that's, you can kind of do the math on that. So that is going to have a different understanding of the R naught value, and of course what kind of issues it can occur and how it can kind of spread, versus that of outside of China. So go outside of China. There's been about 700 reported cases outside of China. About 3 confirmed deaths. So we mentioned that it's about a 2% death rate overall. But we consider outside China, we're talking about a 0.004%. Now, this goes back to my point. How do you consider something that is very serious? So I do want to give a moment to talk about the disease. Something called an RNA virus. RNA viruses are very quickly spread and quickly proliferate and can cause very immediate infections and very immediate results in symptoms to an individual. And a lot of times, because of the immediacy of it, a person can either respond relatively quickly to other diseases, or this immediate kind of, the proverbial punch can cause a lot of damage and lead to a lot of death. So we hear cases of, a 39-year-old individual who, the whistleblower, who eventually, succumbed to the disease. Have another 39-year-old individual who's the director succumb to the disease. That being said, about 15% of the cases have led to death in people over the age of 80. There's been about 0.2%, and this is in Wuhan, 39 years and younger. And so there's a context of who is it infecting, how is it infecting them, and then understanding the geographical location of how well suited that particular province, and again, commending China's immediate response to trying to cut this off. And so I'm telling a lot of this because, again, there's a seriousness to the disease. It can cause a serious reaction, and granted, no one wants to get the coronavirus, because it is not fun, even for the healthiest individual. And for those who are not as healthy, it could lead to very serious illness, if not death. And the biggest issue is the understanding of not knowing how to best kind of keep it at bay. And that's one thing I do want to commend scientists for doing right now, is scientists have moved much quicker in finding vaccines, and finding antiviral strategies, quicker than really any of these other outbreaks have had in the past years. It's actually very interesting is the fact what has created more panic and yet less panic, as weird as that may sound, is the fact of how much more information has been matriculated out here. SARS occurred in 2002, 2004. social media age and the information technology age did not exist or at the level that we have now, of how quickly information is put out there. I do want to speak a minute for the scientists who are getting information out quicker through social media platforms and trying to compare the virus and trying to compare strategies in treating it within weeks. And that is something that does not happen really in a pharmaceutical industry. And so that is almost fascinating to actually see that there is concrete plans. Again, how quickly it can be rolled out is a different question. But the fact that there are already concrete strategies of how to best treat this is somewhat phenomenal. And so that being said, again, I want to provide context to the scientific understanding of how it's spreading, what is going on. I want to leave time for questions because I feel like I am leaving out some holes here. But I did want to bring in another kind of understanding, and this is more from the idea of pandemic level versus understanding reality. Again, the reality can still be very serious. I do want to mention a particular illness that, again, you're talking 26 million to 36 million people that can be infected with. Average. This is not coronavirus, this is another type of illness. Leads to about 17 million medical visits, 400,000 hospitalizations, and can lead to about 14,000 to 35,000 deaths in a year. Now, this is a somewhat high season. That particular disease I just described is the statistics for the flu in the U.S. currently. Something that we have a vaccine for. And again, the vaccine can ebb and flow as how well it works. But I always find it very funny of, again, a very serious illness of the coronavirus. I want to state that. Of not understanding the recapitulation of the flu virus. So I want to provide another interesting number from last year, 9. There was a number of individuals who went to the health clinic that was giving free flu shots here on campus. I've heard it from students all the time, like, I'm going to put off the vaccine. You hear it, you would go as far as the understanding of anti-vaxxers. Realizing exactly what these are trying to do and try to prevent is very important because of issues like the coronavirus, of demonstrating, we have medical intervention that is very much keeping at bay very severe epidemics and pandemics. And that we are lucky to the fact that there has been a very concerted effort to begin addressing the coronavirus, something that right now luckily does not create the amount of deaths that we are hoping, or no, it's not hoping, but that we're glad that we are hopeful and glad that they are not causing the deaths that we were expecting. And so with that said, always keep in context of what is happening here and how these things are being approached, and then to appreciate the ways that other epidemics have been kept at bay, and a lot of the progress that is being made for this one as well. So there, I'm going to leave the floor, time for questions, and I'll turn it over to Dr. Wiecki.
Thank you. All right, what would you like to know? We have our experts right here. Now would be the time to ask. Yes.
So what creates what makes a virus airborne, and then also what makes a virus travel or spread faster than other viruses?
That's a good question, and honestly, it all depends. The real reason I would kind of describe that is honestly their place of choice of where they attach. So let's use Ebola. Ebola is a lot more going to be bodily fluids, because that's going to be more of a place in which they can attach and proliferate and grow. The understanding about, let's use the coronavirus, a lot of the ability of where the coronavirus attaches, he's mentioned the mucosal membrane, where they most do well in is going to be the mucosal membrane of the airways. And that's the lungs. That's where a lot of the emphysema is occurring. That's a lot of where pneumonia is occurring because of where the attachment of that particular virus. There's some aspect about the RNA virus. The type of viruses, there's DNA viruses, there's RNA viruses. There's something we do with that as far as how they spread. There's, based on the chemistry of it. But those are really kind of your two main ways of understanding it. Why do you have some that spread this way? Why do you have some that spread this way? It is all about kind of the attachment and where they're basically going to have better entry into. That kind of answer your question?
Yeah, what about the airborne? Is that like how heavy the virus is?
It
or-
can be. They're all roughly the same size, but yeah, some are going to be a little lighter. That goes back to the idea of an RNA virus. An RNA virus, single strand versus double strand, which the DNA is double stranded, not as heavy, and then just the point of entry of how it's going to be carried.
And I think you explained it also really well, that there is this idea of the R naught, and also the lighter the virus probably, or the easier it spreads in the air, would also then increase the number of people who might catch it. So the fact that we currently think it is about a 2, probably would say it's probably not airborne, because then we would probably see a higher number of spread. But we don't know. So there is also possibility for a so-called silent outbreak, where people might catch it, but because they don't show any symptoms or no strong symptoms, you might not count them as people who actually have the virus and carry the virus and spread it, because 80% might not show many symptoms. So the problem is with the current counting of the numbers is that we actually have no idea how big the number actually is. It might be much bigger than it is. It might be exactly what they report.
Because it's actually interesting that the R naught started at about 3.84, which is like, whoa, and then it got down to 2.5, and it's because more numbers come in. And yeah, a lot about it is the liquid droplet, like you said, the sneezing, things of that nature, and that's where it's going to stay.
And I think you mentioned the measles. The measles have this enormous R naught because this is airborne. So 23 people catching this is no problem, because you go into a room, you go out of the room, and everyone who enters the room for the next, 6 hours would all catch it. So it's extremely dangerous in comparison of spread. This is not the virus, the coronavirus, thank goodness, at least.
And there's one that's actually close to 100, and it's malaria.
Malaria. Oh. So we had a question here.
Is there a chance that if the industrial slowdown continues, that global supply chains will shift outside of China? They'll find different producers?
Markets adjust, yeah,
All right.
absolutely. And it may take time. Expectations matter. And there's so much that we don't know, but if businesses see this as being a long-term problem, oh yeah, absolutely. We find ways to get around it.
How long do you give them until they bite the bullet and move their factories?
Coming back to the U.S. is problematic right now. I mean, there's some need for that anyway because of intellectual property rights issues. We now have more job openings than we have people to fill them. So coming back to the U.S. is somewhat problematic right now. But nonetheless, this thing drags on for, 6-9 months. We've got to start thinking about doing something. It doesn't look like it's running its course or vaccines being made this effective, and you got to start doing something. Yeah.
The problem is probably in the short term, as you were referring to. So in the long term, there might be a way they can finally get around it, but I think in the short term, there might be an impact. On the other hand, as Dr. Lipford has pointed out, because of the new year, falling on the new year, we might actually have almost like a grace period because there is additional supplies already available. But when you read the news, you actually, Honda and some other companies actually shutting down some of their production because they were already running out of parts. So it probably depends on also which company you're looking at.
Again, right now, given what we know right now, given the choice between dealing with the coronavirus and getting Boeing back up and running on the 737 MAX as far as the U.S. economy is concerned, it'd be far better to get Boeing up and running.
Do you think those producers will shift to other cheap labor markets? Like Vietnam, Singapore?
They're already there if
Yeah.
they want to. I mean, I don't think there's anything keeping them from going there if they choose to.
Okay.
Already.
You have a question?
Would we have to worry about this virus on an international level, especially if we don't find a cure or vaccine for it? Does this virus have a long shelf life? Would it eventually die out if we never?
Die out, that's hard to say because like I said, they do belong to a family of coronaviruses. and kind of the same fluctuations that you have with cold and flu seasons. A lot of the coronaviruses follow that same kind of fluctuation of the flu season. Now, that becomes an interesting question as far as being able to diagnose. Because that's another thing. It's funny that we see the numbers going up, drastic. And in fact, was it late January, Stefan, where we saw these numbers,
Spike actually in
February. The reason they spiked was because they now had a better diagnosis. It wasn't the fact that they saw a rise in it, it was just an increase in diagnosis of the actual disease. And so the question is going to start being, how will they be able to better diagnose it? Not to take away this, Wuhan is a very interesting area because of it being so centralized there. It'd be interesting to compare the R0 value of Wuhan versus that of how we'd be able to apply that better, worldwide. And so the question is, how do you transport the information that you have in Wuhan as far as about the epidemic outbreak and how it would honestly affect at an international global scale? The fact is, people don't really know that very well. And because they don't know it, that is where it's been a swing to the right as far as being very conservative, it being a particular global health emergency, the shutting down of flights to those areas. It's been almost trying to just swing in a way to prevent a lot of that because of not knowing. But I would think as they continue to learn more and learn more and learn more about it, just the proactive measures that have been used against the virus will provide a good strategy against it.
Again, I'm not the expert here, but from what I've read at least, SARS is the success story because it was contained and now it's gone. And this would be wonderful if that was the story here. But if it's more like the flu, then it just comes back over and over again, and it would be very tough to actually contain. You might actually be able to find a cure eventually, and then kind of increase the immunity of the general population. That eventually would probably take care of it as well. It might just not then be short term. It would be a long term kind of working towards making it less deadly or something.
So I know Dr. Liu talked a little bit about what China was doing. What are other countries doing it? I know specifically Singapore and Japan and some other Southeast Asian countries have been affected, but what are Western countries doing stuff as well on top of the other non-Chinese countries that we have?
I think that one thing that I want to add to the previous conversation is the level of stigma that is attached to the viruses right now. I think that is becoming a bigger problem than the virus itself. And I want to compare this maybe to HIV. It's really not about the people who are potentially being infected by the disease and are capable of spreading. It's more about the fear and the stereotyping of the people who may be associated with the disease. And that is a scary part when you consider global politics right now. It's kind of, even if you test negative, for all available testing nowadays, you are still unwelcome in other places. And there are even reports of attacks based on the appearances, the nationalities, and as aforementioned about the shutdown of international travel, which was advised against by the World Health Organization. It is the kind of biases that's attached to the outbreak of a disease. I think it is a bigger problem that we also need to consider. As to their responses, I think worldwide that people are apprehensive about the spread of the disease. And particularly that have noted that some nations, they are committed to fighting it and to ship the supplies and assistance to the affected areas. I think that's being very much appreciated. I think that we need a global effort. And as I mentioned, I really do not feel that coronavirus is the last kind of virus that's able to penetrate our society. And given the level of globalization that we have nowadays, that we need to break the kind of political barrier and the stigma in order to fight it together. It is a common enemy to the mankind. So I want to thank you for that question. And by the way, I've noted that Apple stock has been rising today. Okay. And for those of you who do not know what I'm talking about, Apple practically makes the iPhone in China. Okay. And as of today, there has been a resumption of manufacturing facilities in China. It's still not at full capacity, but we believe that this is a one-off event. Unless there's a recurrence, like you get a different kind of virus every year, okay, I think its impact is likely to be short.
As you pointed out, I think the response is strong. Obviously, in any nation closer to the outbreak. I mean, you probably read this. Japan is dealing with its own outbreak on that ship. You have an American response that they set up, these testing centers in I think 5 cities now. I think 3 of them on the West Coast to kind of test populations and see, to kind of detect this early. But I very strongly would agree with Dr. Liu that this must be a global response. You can't be like, trying to kind of have every nation trying to just shield itself from anyone who might actually bring this virus, and especially then start discriminating against, Chinese citizens and see them as these carriers. That could be extremely detrimental, in fact, to a real global response that we need to probably potentially have. We're working together on this. I had another question. Yeah.
Okay, regarding with the source of the virus, I have a lot of different sources. As you mentioned, some says that it comes from marketplace, but an article I just read yesterday says that it came from a laboratory.
Yeah.
It's a joint venture between the French government and Chinese government in 2004, and as a response to the SAR virus. But after the virus, the SAR virus came down, the French left the lab because they found that the Chinese are using the lab for their self-interest. So and then some said that the virus comes from the lab, and when the Chinese ambassador is not denying it could have come out of the lab, which surprised the Washington.
From what I read, this is not true. From what I read, this is a rumor that that supposedly someone experimented in a lab and that somehow got out. It's I don't think from what the virus actually looks like, this is not a weaponized virus at all. It's actually
what's actually been very interesting in the information age, or the technology information age, is more has been matriculated out about this virus at this particular global scale than a lot of other viruses. Let me tell you about one particular instance that was very interesting as far as kind of a miscued false information. There's a new server in which scientific articles can be published. And one of the first things that was published during this, and these are all things that have not been peer reviewed yet, but they kind of try to use a way to kind of get around it. Scientists need to learn about whatever information has been evaluated by other sciences much quicker, and then, hopefully we can go through the peer evaluation process, later. There's this one paper that came out that started comparing the genetic sequences of the coronavirus to other types of viruses. And they found these weird areas, they said there are 4 little areas in this particular virus that resembled the HIV virus. And this person writes, again, this is an academic institution, kind of creates this illusion about, in order for this to happen, there had to be actual engineering into it. That paper was up for about 3 hours on that server and was taken down. Now, why? Not just because they were trying to censor it, But every scientist who is in this field flooded that particular paper, looked at the methodology, and said the methodology is garbage. Because what they were comparing were about 6 amino acids. 6 amino acids compared to this very long genetic sequence of this virus was nothing. It'd be like saying, you know, oh, this letter, this particular sentence has the letter A and the letter T in it, or the letter I and the letter T in it. This sentence is compared to talking about something Hitler said, because there's an I and a T in it. And so a lot of false information about it got pushed very quickly and matriculated very quickly out to the world. And so that's what's going to be very interesting from a scientific perspective. How do we get information out much quicker to help in more intervening, yet still being properly evaluated, in which, you know, the term fake news, false news is not matriculated. So, but what's funny is a lot of people took that and ran with it, just like it was any other little snippet, you know, on the little ticker that you would see on any news outlet, and didn't really understand the context of how, within a couple hours, it was completely just dismissed.
Thank you very much for bringing this up, because yeah, I've read it too.
And what's funny, every other piece of information, and every other scientific article has been able to find the evolutionary tracking of how the virus came to be, where there was recombination events that occurred with older viruses that had, you know, natural selection or mutations that occurred, and they can almost track down exactly how this would have occurred.
You had a question?
I appreciated the point you were making, David, about the importance of, you know, looking at these internationally, and also the fact that China actually has responded very quickly and rapidly in ways that I think the West in the past has not. And what comes to my mind is the way the United States responded to the AIDS virus in the 80s. I think is an example of what we want to avoid, because there's a, you know, because AIDS was initially associated with homosexuals who, you know, our government thought, we don't care about them. So there was really no priority set on addressing that particular virus, and it killed, I mean, tens of thousands of people for many years before there was any kind of effort to make it a national priority. And I think really what created the national priority was when, you know, a young heterosexual boy got AIDS through some kind of, you know, blood transfusion. I think he was a hemophiliac.
Tainted blood transfusion.
Yeah. So the risks of, I think, associating, you know, these epidemics with certain populations is a very big risk, because it allows them to be stigmatized and often forgotten, or, you know.
Discriminated.
Yeah, discriminated.
Other questions?
I have one more. Is there a way for international groups or other countries to reprimand the way China handled the situation with the doctor who found the virus in the beginning, or the way I've heard that China originally didn't tell people about the virus because they wanted to keep that quiet and contain that. So is there a way to reprimand them, or is that being done? Okay. Or is that necessary?
I think in the age of the internet, as previously mentioned, that the social media is very well developed in China. So his story has been shared with the wider group within China. So people knew what had happened. So whatever pressure that could be brought upon the government will likely arise from the people, and to be more conscious about the deficiency of their political system. I think that probably will be the most effective means to to actually change the way that China is governed, to provide more local accountability. I think at this point in time, I do appreciate the goodwill, but an outside interference probably will not be viewed as kindly as the intentions were by the people. And I think at this time, it is, people knew about this, people knew that there needs to be change. I think things will likely develop internally after this event, this crisis is over. So, so I think that's probably a better path forward. Hope that answers the question.
Yeah, I think you answered it perfectly. I think the international pressure on China would be potentially detrimental. I know it's certainly more possible that the internal pressure might do more. And the question is always, so what did they know when? I don't think we have all the answers, even like how long of a period, are we talking about? But if there is a large discrepancy between the time they knew what was happening and the time they take action, that certainly is concerning. And there would probably be some scientists, I hope, who would talk about how there must be information sharing that happens sooner. I'm assuming that these conversations are happening, but obviously it would be tough to know what happens actually behind closed doors. We had some other questions. I'm not sure. Philip, do you have a question? No. Any other? Yes.
One follow-up.
Yes.
David, I've heard that people in China have been sort of allowed to complain about, the sort of cover-up of the doctor who initially identified it.
Mm-hmm.
Have you heard anything to the contrary? I mean, is the party starting to crack down on people criticizing this local Wuhan's government handling of that, or are they still sort of allowing people to vent about that?
That's a great question. Following the initial message that people learned about the event, there had been an outpouring of outrage against the local officials, the local police, and but that has since been censored on the internet.
Okay.
So the government has decided that kind of complaining is not healthy in a time of crisis. But certainly that I still believe that the people, they are more aware of the issues they're facing, and after the crisis, there will be more pressure on the government to change its practices. But as of right now, you're absolutely right. That's not freely circulated information anymore. And that there's a web police who would go out and delete those accounts and make them inaccessible.
And this is a country, obviously, a million times more than I do. This is a country with social credit scores, a country that's cracked down on religious freedom, a country that has not exactly been very friendly towards protesters in Hong Kong. My confidence is that they will tolerate, and you won't let the Winnie the Pooh movie in. My confidence is not great that the government will respond to internal pressures.
Well, maybe
Because Pooh looks like, they say looks like C. So my Pooh.
So I actually believe we are out of time, but I'm glad that you guys came here. Thank you for asking questions. When you look up information, make sure it's sourced, that it is reliable information. As a lot of the stuff that you find on the internet is not reliable. A lot of the stuff that you look on YouTube is not reliable. So beware of any kind of panic, like, oh my gosh, tomorrow the world ends, buy some toilet paper before it's too late. You probably don't need to stock up on toilet paper right now. But it's still not a bad idea to keep informed. Keep informed, make sure that you know what's happening, support, the efforts to actually, send goods, help to China. I think this is a global response. It has to be a global response to this in order to make, I think, a real impact here. So thank you very much for coming. I greatly appreciate it also. Yeah. Yes, and wash your hands. Don't forget to wash your hands. Absolutely. Wash your hands.
Thank you, Stefan.
Thank you.